Hey guys, this is Sarah and it is Saturday. I'm late again because I suck and I have lots of crap going on right now, so I apologize for that. This week we are talking about surgery and where our partner had their surgery done, if they've had any surgeries, and if it was covered or not, etc., etc. I haven't had a chance to look at any of the other videos yet, because I have been so busy, so I'm not sure if I'm going to miss anything in this video, and if I do, feel free to ask me any questions below. So Seth is about 2 years, he will be 2 years post-op top surgery in February. He had his surgery done with Dr. McLean here in Mississauga, Ontario. He's a pretty well-known surgeon in this area. Actually, I think that all of my male trans friends have had their top surgery with him. He's kind of like the Garamoni of Ontario, I guess you could say. He's a really awesome guy, and his staff is wonderful. And we had a really good experience. Seth didn't have too much pain. I should mention, he had a double mastectomy via a double incision. He was slightly too big to have the other surgery done. I can't remember like the technical term for it. I'm having a brain fart right now, but he was slightly too big. He wasn't like huge chested to begin with, but he just wasn't able to do that surgery. So he had the double incision, and it looks amazing. He didn't have too much pain afterwards. The only issue he really had was constipation from pain medications and sleeping on his back in a bed. He wasn't able to do that for about a week or two. He had to sleep in a reclining chair. But other than that, he recovered pretty quickly. His scars look amazing now. He was putting vitamin E, like legit just plain vitamin E, like oil, I think it was, or yeah, I think it was an oil. He was applying that for a while there, but not religiously. And his scars look really good. He is fairly hairy, so they kind of recovered anyway, but I'm pretty sure that in about 5 years you will barely be able to even tell, because you can barely tell now. His surgery was paid for mostly by his family. Actually, I think it was all paid for by his family. His mom and dad pitched in some money, and his grandparents pitched in money. I can't remember who else pitched in money, but I think it was just his family, and then I also pitched in some money, whatever I could afford at the time. So that was really great. He didn't have to pay for anything. They didn't keep him overnight or anything. He went home after about an hour of recovery, and that was pretty much it. And then he's just recently had his hysterectomy. It's been a month. On Tuesday it will have been a month. And he had his hysterectomy with Dr. Pineva, I'm not sure how to pronounce her last name, in London, Ontario. She's pretty familiar with the whole situation. She's done the surgery for many other trans men, so she was very sensitive and educated, and just awesome overall with him. So that was really good. The staff was awesome. He had that covered. I think I've mentioned in a previous video that he made friends with a trans woman when he was living in London, and she kind of showed him some of the ropes and let him in on some tricks and tips. So he did not change his gender marker on his health card, and he was able to have his entire hysterectomy covered. So I would definitely recommend that for anybody living in Ontario, possibly in Canada. I'm not sure if it's all across Canada, but definitely in Ontario, and you're just starting your transition. Do not change your gender marker if you want to have your hysterectomy covered, because that's basically the only way. So yeah, he had that covered. He was in a fair amount of pain right after the surgery. They won't let you go home until you are able to pee on your own, and that took him a while. But he finally did later on that evening, and he was able to leave without a catheter. He did have to have an in and out catheter, which is basically when they insert a catheter and they drain your bladder and kind of get it moving, I guess. That was a really awkward experience for him, but the nurses that he had were really great, and I'm sure that they've dealt with it many times before. So although it will be uncomfortable for him regardless, they made it as comfortable as it possibly can be for him. it was a little bit painful as well. Obviously, it's a tube being shoved up your pee hole. Like, it's gonna hurt a little bit, but so he had that done. And then he didn't really have too much of an issue peeing afterwards. He just had a little bit of like burning for like maybe a couple days, but that's generally pretty normal. And now he's fine. So he's recovered very, very fast. His incisions you can still see, but they are healing over very well. He had, I should mention this, that he had his hysterectomy laparoscopically. So they made 2 incisions on either side of his abdomen, kind of close to his hip bones. And then they made an incision inside his belly button, and they remove everything through, for lack of a better word, the manhole. We don't really call it that, but I don't know what else to say. That isn't offensive, so that's what I'm going to use. And the reason why he did it that way, even though he has extreme dysphoria, is because there's less of a recovery time. So he wanted to do it that way, and he didn't want really another big incision when he already has 2, so it worked out really well. I think that's really it. I can't really think of anything else that I would have to talk about. Oh, well, I guess I should talk about what he wants to do in the future. He does want to have bottom surgery, some form of it. He's not sure what he wants to do. He thinks that he wants to have meta done first, or it could be the only surgery he has. Right now, at this point, the way that phalloplasty is looking, he's not too thrilled with it. He doesn't think that he will be happy, and will possibly even be more dysphoric than he is now. So he's not really sure about that yet, but they recommend you get meta before that anyway, so it's a stepping stone, and if he's happy at that point, then great. If not, and they are able to develop a more functional, if they're able to come up with something more functional and something that looks more like what he feels he should have, then he might go forward with that, but that wouldn't be for a while. So he hasn't picked a surgeon or anything or a date. He wants to give his body at least like 3 to 5 years to recover from having the 2 surgeries that he's already had. And then, of course, like, we'd have to save money for it and everything, so he wants to wait for a little bit for that. I guess that's pretty much all I have to say. Like I said, I didn't get to watch the other video, so I'm not sure what the other girls talked about. If I did miss anything, please feel free to ask me any questions below, and I'll hopefully get back to you as soon as possible. Have a good week, guys, and I'll see you next week.